You want to go beyond a facial and actually have some more permanent results. Dr. Todd Van Yee from the Center for Aesthetics and Plastic Surgery in NENA is here to talk a little bit about facial surgery. Good morning. Happy New Year.
Good morning, Amy. Happy New Year to you, too.
Well, you guys do all sorts of wonderful things at your place, from Botox to facials to all that kind of stuff, wonderful cosmetics, but you also take a step beyond.
We do. And we've talked before about some of the non-surgical procedures. And it's important to know that there are things beyond that, and sometimes you need to have something or desire to have something beyond that. One of the things I like to tell my patients about, and I think is very important because there's a lot of misinformation out there, there is no such thing as a non-surgical facelift.
Okay.
And while lasers do a great job, and while Botox is fantastic, and some of the fillers are great, there comes a time when you really need to step it up and do a little bit more, certainly for some people. Now, I say that with the understanding that most people don't actually want to be extremely made over. They want to look like themselves.
Right.
But there are conditions such as skin laxity in the neck, skin laxity of the eyelids, droopiness of the eyebrows. Those just can't be corrected adequately with non-surgical techniques. So some of the most common things that we'll do would be something like a brow lift, to open the eyes up a little bit more, eyelid surgery to take away some of the extra eyelid skin, then in some cases causes people to be or to look tired or fatigued. Many patients come in saying, "Oh, my kids, my grandkids say, why are you so angry looking?"
Right.
And they're not.
Right.
But they want to look, but they look that way, and they want to be improved in their appearance.
Doctor brought some pictures along, and we're just going to go through them because it is amazing, and some of these surgeries are life-changing. So this is the after of the neck lift, doctor. Wow.
Well, this is one of the most common things. My mother has actually been talking to me for years about, "Todd, can you do something about this right here?" What I like to tell people is if the condition that you're concerned about is something that you can pinch between your two fingers, it's probably something that's not going to be fixed with a laser or Botox or a facial. It's something that's going to need to be corrected surgically. A lot of patients come in with extra skin, especially in the neck, and they're very concerned about here. Here in this picture, this is a before picture of somebody that actually had visual difficulty because there's so much eyelid skin that's draping down on her eyelids and resting right on her eyelids. And what we did is we removed eyelid skin, opened the eyes up. They look brighter. She looks more awake. She doesn't look so tired. I've actually had patients that couldn't read, couldn't use the computer, couldn't watch TV because there's so much eyelid skin.
But she still looks like her. You know what I mean? It's not. I think people get scared off and they see some of these Hollywood actresses, and it's like, what did she do?
Well, they do, and that's again a very important part of patient education is telling them that most people don't want to be on the cover of a tabloid magazine.
Right.
They want to look like themselves.
Right.
In fact, I'll go so far as to say most people don't even want to know, want others to know that they had something done.
Absolutely.
And I think a very good result in plastic surgery is a result that doesn't look like you've had plastic surgery. The eyes in this patient were clearly brighter and more open, but she looked like herself.
Absolutely.
The lady that had the facelift and the neck lift, she clearly looked like herself. She wasn't necessarily trying to be glamorous or sexy. She just didn't like all this extra skin there.
Right.
Most people, again, don't want to be extremely made over. They want to look like themselves. If you're 50 years old, you don't want to look like you're 60 or 70. If you look like you're 45, 40, great. But most people have a condition. Neck skin laxity, the jowl right here, the eyelid skin, droopy brows. Those are the most common things that will correct the surgery.
If somebody comes in and says, "I want it all," I'm assuming you say, "No, you know what I mean? You know, that's not probably the candidate. You know."
Well, you've got to be really careful.
Right.
Absolutely. Now, I'll go through a very thorough consultation with them, basically starting from the top and working all the way down. Not, in some cases, saying you don't need this and you don't need that, but at least as part of the conversation so people understand what they're having done, why they're having it done, what a certain procedure is going to achieve, and what it's not going to achieve.
And before we go quickly, are a lot of the recovery times pretty amazing? Are these people back at it?
You know, that's another great question. People always ask, how long am I going to be off? There's kind of a misconception out there that, you got to put a paper bag over your head for 6 weeks and you got to hide. Most people, even with eyelid surgery, forehead surgery, facelift, neck lift, and that's common to do all that at one time, would look pretty darn good in 7 to 10 days. I've had patients that look pretty good, like you'd walk past them in the grocery store 5 to 7 days after surgery, and you wouldn't know they'd had something done.
Wow. Good to see you. Really appreciate it.
Very good to see you
amazing
again,
results
Amy.
for sure. So might want something to consider for the new year, a new you. Again, Dr. Todd Vanier from the Center of Aesthetics and Plastic Surgery. Thanks so much.
Amy.
Happy
Good
New
to see
Year.
you again. You too.